Firearm deaths grow. Disparities widen. Firearm deaths continue to be a significant and growing public health problem in the United States. In 2020, 79% of all homicides and 53% of all suicides involved firearms. From 2019 to 2020, the firearm homicide rate increased about 35%, and the firearm suicide rate stayed high. The firearm homicide rate in 2020 was the highest recorded in over 25 years. Young people, males, and black people have the highest firearm homicide rates and experienced the largest increases in 2020. The suicide rate grew the most for American Indian and Alaska Native people. Counties with the highest poverty level had firearm homicide rates 4.5 times as high and firearm suicide rates 1.3 times as high as counties with the lowest poverty level. The reasons for the increasing rates and widening disparities are likely complex. Multiple stressors associated with the COVID-19 pandemic may have contributed to the increases. Firearm deaths are preventable, but not inevitable, and everyone has a role to play in prevention. To learn more, visit www.cdc.gov/vital signs. Information for healthcare and service providers. Hospital-based programs that intervene with victims of violence can prevent future violence, and interventions with those at risk for suicide can prevent future reattempts. Counseling and education, paired with giving out a safety device like a lockbox, are associated with safer firearm storage practices in the home. Community organizations, hospitals, and clinics can expand access to social, emotional, physical, and mental health services and supports to prevent substance use and suicide attempts, and to address trauma associated with violence and prevent the continuation of violence. Information for community partners. Community and street outreach programs engage populations at higher risk for firearm violence and connect them with community services while reducing tensions that may lead to violence. Individuals, communities, and businesses can promote safe firearm storage practices to reduce unauthorized use of a firearm. Many approaches, like mentoring, supporting norms against intimate partner and other violence, teaching coping and problem-solving skills, and programs to prevent substance use, have far-reaching benefits, including increasing well-being and reducing key risks for all types of violence. Enhancing and maintaining green spaces, like cleaning vacant lots and planting grass and trees in high-risk areas, can change the physical and social conditions that contribute to violence and inequities. Revitalized vacant lots in communities are associated with reduced firearm assaults in the areas with the highest poverty. Information for local and state governments. Communities and governments can use data to select effective and sustainable programs and policies to address the underlying conditions that contribute to violence inequities and enhance safe firearm practices. Policies to address household and economic stability can have a long-term impact by reducing family poverty and other risk factors for violence.